Hi, everyone. Welcome back to Emergency Chaos, where we talk about tips and tricks for ER nurses. Today, we will be discussing a simple yet effective mental model for taking care of ER patients. It's a simple way to organize your thoughts and to think through patient care and possible complications. You shouldn't just go through the motions, you should be anticipating, preparing, and being proactive, especially as a new grad in the ER. So, what is this simple process? It's a three-step process, and let's go through it now. So you're gonna ask yourselves these three things, these three questions every time you get a new patient in the ER. So what is the first question? What is the first thing you're gonna ask yourself? It's gonna be, what are my patient's complications, patient's problems, or what are their diagnoses? The second thing is, what can I start anticipating? What should I be doing at this moment in time to be proactive? And that's in regards to what medications can I anticipate for this patient? What medications can I start getting ready? Do I need to mix any of these medications? What labs do I anticipate having to draw from this patient? Any radiology? Would they have to go to CT? X-ray? If they have to go to CT, is it something that's going to require a larger vein access in the AC? Do I need to be contacting respiratory therapy at this time? Any procedures that this patient may be undergoing? Do they have to be intubated? A central line, a chest tube, arterial line, ventrix, suture, and etc. And how do I, as the nurse, prepare for these and make the procedure go on smoother? And then the last thing is, what are the possible complications related to my patient's problems, to their complaints, to the diagnosis? How can I monitor for or prevent them? So, are you going to monitor the respiratory status, their cardiac status, their neural status? How do you monitor for these complications and prevent them from happening? Just to take the example home, I'm going to give you an example that we can walk through together so you can solidify what I mean by this three-step model. So here is an example of a patient. So heroin overdose brought in by ambulance. Patient received Narcan en route and is now alert and oriented, however, slightly drowsy. Patient is handed off to you, you assume report. So going back to the three-step model, what are we going to do for this patient? So what's the first? What is my patient's problem? Compromised respiratory drive and mental status related to heroin overdose. Second, what can I start anticipating as a nurse? So we can anticipate that we're going to require close monitoring of their respiratory status via cardiac monitor and pulse oximetry. You can even add Untitled to that just to ensure close monitoring, as well as frequent contact with the patient to ensure that there's adequate chest rise and fall. A lot of the newbies in the ER tend to just rely on the cardiac monitor and pulse oximetry, but remember that we do not treat the monitor, we treat the patient. So you have to have frequent contact to evaluate your patient to make sure that they have a good chest rise and fall. Another thing that we anticipate is having IV access, having Narcan ready. Doesn't have to be at the bedside, but you know where it's at. It's readily available, so where you can pull it if the patient needs to be redosed. And having oxygen equipment readily available. That can be just a simple nasal cannula, a non-rebreather, an NPA, or even intubation equipment, because you never know what can happen. So the bottom is going to be declining. So the bottom question is, what is the worst possible complication? And the worst possible complication is declining respiratory status leading to arrest. So why would this happen? One is that you leave all the monitoring to the monitors and don't assess or at least visualize your patient, as we were talking to earlier. What I'm trying to say is that we treat the patient, not the monitor. Two, it would be lack of knowledge. You keep reassessing and your patient is fine, so you stop coming in as often to visualize your patient. Then you come back an hour later and you find your patient blue. You do not know how long Narcan works for. This time you knew it was heroin. What if you didn't know what drug it was? So it just goes back to the previous video where we talked about having this fundamental knowledge. So let's say you're a new guy in the ER and your patient came in for the OD and received Narcan. What are some things that you should be looking at that you perhaps don't know of? How long does heroin last in the body? How long does Narcan work for? How many times can you redose Narcan? What's the typical dosing? That kind of stuff. Those are things that you need to be looking up for every single patient that you get in order to build your own foundational knowledge so that over time you can become more competent and more confident in your skills. So, preventing the worst complication will require knowledge, close monitoring, and redosing of Narcan as needed, and maybe intubation, but it requires close observation and redosing of Narcan. Some quick tips, and of course, follow your own hospital's policies and guidelines. But from my understanding, Narcan lasts approximately 45 minutes, even longer, But what happens when it wears off? Or did you actually give enough? The patient may OD again because the Narcan wore off and there is still heroin or whatever drug inside their system. So you are going to have to monitor your patient for several hours to ensure that the heroin and any other drug is out of the system. Okay, guys. So that was a three-step process to look over your patients to ensure that you are being thorough and preventing any complications. Just to review it again, what are my patient's problems, complaints, diagnoses? What can I anticipate? And what are the possible complications and how do I prevent them from happening? Thank you for watching. If you want to support the channel, please head on over to Etsy and check out some of our merchandise. And as always, in the ER, teamwork makes the dream work.